Now, as a speech language pathologist, I work with adults who have suffered from a stroke, and in this video, I'm going to provide some common communication disorders that can result from a stroke. These common disorders include aphasia, dysarthria, a cognitive communication disorder, apraxia of speech, and voice disorders. Now, before I discuss each one, let's briefly review what a stroke is. So, a stroke is a neurological insult of the brain that results from either a blockage or a bleed of a vessel. A vessel is just a tube like structure that carries blood throughout the body. So, the bleed or blockage can be from an artery, which is the most common, or from a vein. If the stroke is from a blockage, then this is an ischemic type of stroke, which is the most common type of stroke. If the stroke is from a bleed, then this is a hemorrhagic stroke, which is less common. The other type of stroke that can occur is known as a mini stroke, or TIA, a transient ischemic attack. Transient meaning that the symptoms go away and resolve on its own. Ischemic meaning that it's from a blockage. An attack meaning that the insult took place in the brain. Now, I look at a TIA as the body's way of warning the person to make some immediate changes to their diet and or lifestyle because a TIA can progress into a full-blown stroke. In fact, according to the American Stroke Association, 1 in 3 people who experience a TIA will have a major stroke, and about 10 to 15% of those who have a TIA will have a major stroke within 3 months, with half of those occurring within the first 48 hours. Now, I mentioned common communication disorders earlier in this video that can result from a stroke, and I said that this includes aphasia, dysarthria, a cognitive communication disorder, apraxia of speech, and voice disorders. So let's discuss each one by one. Aphasia is an acquired language disorder that affects a person's ability to speak, understand language, read, and or write. Since about 80% of strokes occur on the left side of the brain where our language center is located, it's quite common for this type of disorder to occur. Keep in mind, however, that aphasia, despite affecting a person's language, the person's intelligence remains intact, meaning that most individuals who have aphasia are actually well aware that they have trouble communicating and are very much aware of their errors.
So how are you doing today, Kent?
Chambers. Okay.
Okay. Are you having pain anywhere?
No.
No? You feel pretty good in general?
Yes.
Yeah. You can understand what I'm saying to you, right?
Yes.
Okay. Can you close your eyes for me? Perfect. Now tell me your name.
Cause I've had
I'm not gonna problem.
no I am.
Dysarthria is a speech disorder caused by weakness or poor coordination of the muscles used for speaking, like the tongue, the lips, the vocal cords, or diaphragm. This can make a person's speech sound slurred, slow, quiet, or hard to understand. Now, even though the person knows what they want to say, their muscles may not work well enough to get the words out clearly. And dysarthria can not only happen after a stroke, but it can also happen with a brain injury or with conditions like Parkinson's or ALS.
Can you tell me how long ago it was since you've had your stroke?
It's last September, had it, and down to hospital to Tuesday. I got out 2 days before Christmas. I got out of hospital.
A cognitive communication disorder happens when a person has trouble with their cognitive or thinking skills, and this affects how they communicate. So these cognitive skills that can be affected include memory, attention, problem solving, following along in a conversation, or even organizing your thoughts when you're speaking. This one is not necessarily about a speech disorder. This is really more about your thinking ability and how it affects your overall communication.
Well, I'd become increasingly bothered that I was forgetting things, mainly how to do things.
Well, I knew there was something wrong before I went. I could feel the stopping, and it was irritating.
we were having a conversation and Larry was telling a story, he'd get to a word and then he would just stop and try and drag the word out, what he wants to say. And then he'd look at me probably and I'd suggest a word that, to fill in.
Now, acquired apraxia of speech is a motor speech disorder where individuals struggle to plan and coordinate the movements needed to produce speech, even though their speech muscles are intact. So for someone who has apraxia of speech, they may exhibit inconsistent articulation errors, difficulty starting a word or saying it smoothly, groping movements with their mouth, and this could look like they're trying to find the right position to say the word. Their speech is slow, it's effortful, and it's quite often hard to understand. And lastly, the person typically becomes really frustrated because they know exactly what they want to say, but they just can't get it out.
Local woman has a rare condition that affects the way she speaks, but new this morning, she tells 9 on Your Side's Lisa Smith she wants people to know that she can communicate.
Hi everyone, it's Joanna. Meet Joanna Bindle. She has her own YouTube channel as a way to show young people that they can do anything, go to prom, take family vacations, and more, despite having a speech disorder.
I have speech apraxia, which is a disability which makes it unclear sometimes. I can understand you.
It's a rare condition, but Joanna works hard at making the most of her situation.
Her personality and her overall sense of humor and joking, has helped her get through it.
Do you have a job now? Tell me a little bit about it.
No job.
And the experience has been invaluable.
They did talk to me like I no more go like them.
Hi. My name is Gina. I am 43-year-old. I have Apraxia of Speech.
I know sometimes it can be difficult to differentiate between apraxia of speech, aphasia, and dysarthria, but the most simplest way to do this is to think of it like this. You have a thought that you want to express. Your thoughts are in your language. In order to speak your thoughts, your brain must send a signal to the muscles to move in a particular way. Your muscles then obey the command and you speak your thoughts. Now, if you have a problem with your thoughts, that's aphasia. If you have a problem with the connection between the brain and the muscles, that's apraxia of speech. If you have a problem with the strength of the muscles to move, that's dysarthria. A voice disorder is a condition that causes a change in how the voice sounds, like changes in its pitch, its volume, or its quality. It can affect a person's ability to communicate effectively and can result from various factors, including structural changes in the vocal folds, muscle tension, voice overuse, or in this case, from neurological issues such as from a stroke. There are two common voice disorders that can occur after a stroke. The first one is dysphonia. Now, dysphonia is a general term that means difficulty producing voice. So after a stroke, this can happen when parts of the brain that control voice and breathing coordination are damaged. So dysphonia might sound like having a weak or a soft voice, your voice being hoarse or breathy or has like a rough vocal quality to it. Your voice may be really strained and sound tight. It's like a tight sounding voice. You can have changes in your pitch or volume, and you can have voice fatigue or shortness of breath while you're speaking. The second common type is what's known as vocal fold paralysis. So this occurs when one or both of the vocal folds do not move properly, usually because there's nerve damage after the stroke. There are two types of vocal fold paralysis. You have unilateral paralysis, which is where one vocal fold is affected, so your voice may sound really breathy or weak. And then you also have bilateral paralysis, and this is where both of the vocal folds are affected, and this can be more serious and may actually affect breathing as well as your voice. So with vocal fold paralysis, your voice may sound really breathy, almost as like you're whispering. You might also experience an inability to project your voice, so to make your voice louder. You may have some trouble swallowing, and this is an aspiration risk. And then also, your voice may typically fade while you're having a conversation.
Good. Say E and sniff like this. E. E. Good, good. Now sniff 3 times. Good. Slide from a low note to a high note like this. E. And go high to low. E. Excellent. Good.
So in conclusion, a stroke can really affect a person's ability to communicate in a multitude of ways. And it really is a neurological insult that can leave a person with mild impairments to severe disabilities. If you've watched this video all the way up until this point, thank you. But also please like the video. It really helps the algorithm of my channel to get in front of people just like yourself who would also find value in this information. I'd love for you to join the community and to subscribe. It's pretty cool over here. So thank you so much for watching once again, and I will see you in the next video.